second one, I was watching the video, I was really struck by the impact of this scenario on this woman's life in terms of her health. I mean,
Yes.
We're seeing her with these bottles of medicines in front of her. This son is not going to get her that extra medication that she needs. And she's, the anxiety and the depression that must go along with her living situation, portends really bad outcomes for her, both medically and emotionally.
And even though here we heard the emotional and the verbal, I was just wondering if there's some financial exploitation going on, and that's the reason he didn't want to fill the medication. He said this costs so much money.
Exactly.
And it looked, at least in one scenario, that it was close to physical abuse. He got a little close,
Right.
and I was pretty worried there. She needs to be evaluated cognitively and evaluated for depression, because that can often affect, as we mentioned before, memory and function. So, yeah, she needs a full comprehensive assessment to kind of give her the right treatment that would actually, I think, go a long way to help her participate in whatever the assessment and intervention would be.
I think also we have to be careful because sometimes family members will say, oh, she's demented or she's crazy. And then we do our own evaluation and find that there really is no cognitive impairment. They may have forgotten something and right away the son or the daughter is saying, oh, she's demented, when that's not really the case.
Yeah, and I have to say, in the video, she did not look that cognitively impaired to me.
No.
But exactly,
No.
exactly. So
And
that's
he
a
was
good point.
stereotyping her.
Yeah.
And she was right. I mean, she seemed to be
pretty
very
good,
much on top. Well, did you bring the medicine?
Yeah.
And then, of course, she was so threatened that, she changed. And you could see her security and stable responses diminish as his behavior escalated.
Yeah. When I see people who come in who are anxious and depressed, that part of that evaluation should include, are you safe? Do you feel safe at home?
And who do you live with, and how long have they lived with you, and has anything happened? Yeah, it really does put us on the alert. I will ask, is everything okay at home?
Yeah.
Meaning, this is something that has become a national problem,
Right.
and we need to ask about it more. What can you tell us about who comes into your home, and if you have aides, how are they doing? Family caregivers, meaning really questioning everyone, that actually is something doctors and social workers and nurses want to hear about,
Right.
I think becomes important. I mean, certainly if a patient like this mother comes into the office and is not adherent to the medication regimen, you have to wonder why. This is someone who really follows regimens. Why isn't she doing it? It makes you wonder. Or if someone who had been doing well is failing to thrive, why? Why is that happening?
What's the change about?
Sometimes even in the office, our registrars are very aware of family dynamics, and what would not occur in front of the doctors or nurses or social workers occurs in the waiting room, and they will report
That's
that.
an excellent point, because we have to really rely on everybody in the team, from everybody, the registrar, the, cleaning person.
Creating a close relationship with the patient is huge. I mean, whoever on the team creates that relationship, because no one's going to self-reveal or go ahead with any of the proceedings if there isn't a real intense sense of trust.
Yeah. As we know, people who are abused feel so threatened that, there's really a control issue between the abuser and the abused, and it can just take a little bit of a look between the abuser and the abused to let the patient know that, hey, don't say anything bad here or you're going to get it when you get home. So it's really important to separate, if you think that there's anything going on, to separate the alleged or questioned abuser from the patient and interview the patient alone in a sort of gentle way.
Yeah, absolutely. And if there is a reluctance on the family member to leave the interview, that gives you a clue why. Why is there reluctance, or why is there a lack of receptivity for visiting nurse to come in?
Exactly.
That gives you some idea that something might be awry.
I think as physicians, you might have a little leeway because you could say you need to examine the patient and have the person leave.
Right.
I think as a social worker, sometimes I'm a little afraid of rocking the boat, even though I know it is very important to give them that opportunity to speak confidentially, because we might be the only outside contact. And if the abuser suspects that we think something's going on, they may not bring them back.
Right.
That doesn't always happen, but I think, again, we need to just be aware of that because we could lose them.
I might casually, during the interview, if the alleged abuser is there, I may say, you know, how are things with you and what is your work like? And if they say, oh, I don't work, I might say, well, that's that must be very stressful for you.
And if there is evidence that there is stress, you'll try to figure out in what areas is there stress, because the more we know, the more perhaps we can do something as an intervention to make it easier. So when you really think there is something actively dysfunctional and dangerous, we will admit patients. We've done that many times when it's quite clear someone isn't getting their medicines, they're in heart failure and no one's really attending to them. Someone who has a dementia, who can't in any way help themselves. This leads to admissions very often, which is at least one way into safety.
Right, and we need to educate the next generation of all healthcare professionals that, you know, of the prevalence of this, of the negative health outcomes of this, and that, you know, any of us, and I am guilty as the next one, who is doing primary care is probably missing a ton of cases. And so just to have it constantly in the forefront, in our radar, on our radar, that it exists, I think is really important.